Hi everybody, so my name's Callie Blackwell and I am the mother of the boy in 7 billion, my son here. The story behind that name is basically when he was 10 years old he was diagnosed with acute lymphoblastic leukemia, and then when he was 12, whilst on active chemotherapy, he was diagnosed with a second, much rarer cancer called Langerhans cell sarcoma. And it made him, unfortunately, the only person in the world to have the two cancers together, hence the boy in 7 billion. I think it might be 7 point something billion now. And so there was no protocol for him. They didn't know what to do with him. They had no idea. He'd already had all the chemotherapy for the leukemia, which had obviously triggered this second cancer. So we're now looking at more chemotherapy, and the only thing they could think to do, because after many genetic tests they worked out that both cancers resided in the bone marrow, they decided that a bone marrow transplant was the best thing to do to stop either cancer coming back. So he didn't have cancer at the time. The chemotherapy had got rid of the leukemia in the first place. Surgery had taken out the Langerhans cell sarcoma, which presented in his tonsils. So he was, as far as tests could show, he was cancer-free, but of course they wanted to prevent it coming back. So we embarked on 5 months of intensive chemotherapy again, which was actually an adult dose, because Durham, when you relapse, they can't give you the same drugs because they don't work for the second time. So they give you adult doses. The words were, we are going to give him everything we can without killing him because we don't know how much to give him. They told me he'd be infertile. They told me that his bones would probably, be crumbling by around about now. Yeah, that's what they promised him, basically. You'll step off a curb and your ankles are going to crumble in the future. And very pleasant things that came along with the chemotherapy. We then embarked, we moved to Bristol from Norfolk, and we embarked on the bone marrow transplant. Now, Darren, not only being the only person in the world, decided that he was going to have a bone marrow transplant fail, then a second one failed, then a third one, which was his own cells. So the two donor cells hadn't worked. It was a concoction of drugs that they'd given him, and it had an adenovirus at the same time. And so the first two donor transplants actually failed. So thankfully, they had the good sense to take a donation of his own bone marrow from him before they started the conditioning. And so they gave him a bag of those back, and they said, nobody's ever failed to engraft with their own bone marrow. That's impossible. The third one failed. So in the October of 2013, Darren had, thankfully, someone had the good grace to split that donation into 2 bags. So the second bag he had in the October 2013, they told us that if this didn't work, there was no chance. There was nothing left now. If this didn't work, nobody can live without a functioning bone marrow system. So this wasn't going to, if it didn't work, we were in deep trouble. 3 days after he had his transplant, he trapped his fingers down the side of his bed, and he picked up 2 catastrophic infections in his hands and 1 in his mouth. Now, they told us that if you don't engraft by day 50, there's no way it's going to work. Nobody's ever engrafted, and that means that the bone marrow takes over the bone marrow and starts to produce your own red blood cells. You usually see that around about day 21, day 24. Day 21 came, there was nothing there because these infections were ravaging him. So we went through many different treatments trying to get rid of the infections that they told me would kill him if they weren't treating them with these very detrimental and very, very harsh treatments, which none of them worked. We got to day 46 and they told us that there was nothing in his bone marrow, so we had no choice now but to take him to a hospice. This was palliative care. We signed the do not resuscitate forms. We went through the death plan with his doctors. We told them exactly what he wanted. He told them exactly what he wanted. And they told me that once we took him off of the antibiotics, that he would have 3 days to live, a week at most if we were lucky. When did we want to go to the hospice? So we decided to go to the hospice on December the 8th, which was 7 days after his 14th birthday. And, we moved there on December the 11th, didn't we? We moved to the hospice on December the 11th, so we unhooked him from everything. I'm prepared to basically have 3 days left with him. And 3 days passed and he didn't go anywhere. A couple of weeks passed and he still didn't go anywhere, but his organs had started to shut down and he was very slowly... They kept telling me this was the beginning of the end, so they were bringing in other drugs, but he was on no drugs now other than palliative care, which is morphine and some sleeping tablets and basically some things like that, anti-sickness, things like that. Now, previously to this, Darren, the 2 infections in his hand, had caused 3 of his fingers, his thumb and his 2 fingers here, to actually be necrotic. So down the fingers from the knuckles up were black, they were dead. And this was causing incredible pain for him because it was like frostbite. He was feeling his hand die. And he was on morphine, he was on fentanyl, he had everything. They couldn't give him any more pain relief. And so I asked them, I'd looked into it, natural things for pain relief, other pain reliefs, and I'd found Bedrocan, which was a pain relief medicine that was available in the Netherlands. So I asked the doctor, can we please have Bedrocan? You know, you haven't tried everything. And they said it wasn't licensed for children, forgetting that most chemotherapies aren't licensed for children either, but it doesn't stop them. So we were told no to Bedrocan, so I thought, well, what's the main ingredient? Cannabis. Surely I can find some of that. How hard can that be? And I did, and we found some, and we made a tincture to put in a vape pen, actually. This wasn't for him to ingest, it was just to put in a vape pen while he was in the hospital. And he was using it, but it wasn't really effective enough. It didn't really cause, it didn't get rid of the pain, so we thought no more of it. Now fast forward a few more weeks and we're in the hospice. Now Darren's getting very, very anxious because he's not dying and he wants to die and it's not coming quick enough. And the hospital are telling him any day soon, you know, your stomach's now not working and this is happening, this is any day. And he got very anxious. So they started to up the morphine to try and sedate him. And he had specifically said in his death plan that he didn't want to die in a morphine haze. He wanted to be compos mentis because they'd taken everything from him, they weren't going to take that. So with that, I obviously saw, as his mother now, the one last thing I could do for him is give him his dying wish. I can't save his life, I can't do anything else. I can just try and give him what he wants right until the day that he takes his last breath. And so watching him go on morphine, and I knew that's not what he wanted, I had to ask him to take it away, and I did. But the anxiety came back tenfold. Now day 69, I asked, because obviously he was still here, this was day 69 after the transplant, I asked for another bone marrow aspirate because they told me he should be dead by now, and I said, I want another test. So they went into the actual ball joint, took out some bone marrow and looked at it. And they came back to us on day 69 and said, there's nothing in there. There is nothing. I'm so sorry, it's just a matter of time. Which of course, Darren's anxiety went through the roof even further. It's like, oh my God, there's you know. So then they started to introduce lorazepam, which is a sleeping tablet. And again, he was off his face. He was just unconscious. He wasn't there. And I thought, well, this is still not what he wanted. So I looked at the jar of the tincture that I'd made a couple of months earlier, and I thought, well, cannabis chills you out, right? So I'll just give him some of that, but I'll let him eat it this time. So I drew up a syringe, put it in his mouth, and within half an hour, his whole demeanour just changed. He relaxed, everything. I saw him sink into his bed and kind of look at me and say, wow, it's... And then seconds later, a nurse turned up at the door, and I shit myself, I'm not going to lie. A nurse turned up at the door with a drug called cyclazine. Now, this drug called cyclazine is only an antiemetic, so it's anti-sickness. It's a Valium. Okay, oh God. Learn something new every day. They came to the door with this drug. Now, it's not supposed to be addictive, but unfortunately, the way that the hospital had to administer it, because they didn't have the time or the equipment to administer it over a 15-minute push, they would very often give it to him very quickly, and he became very, very addicted to this drug. I mean, I'm talking smackhead addicted, where he would be worse than Morbier, where he would be screaming at the doctors, I want my son, and then he'd say, what, you, I'm going to go to sleep until I can have it again. So when the nurse turned up with the cyclazine, bang on the dot, because it wasn't worth their life if it wasn't there at the door. And she looked at him and he said, I thought, oh my God, contraindication, what have I done? What if I cause an overdose? What if I kill him? Well, he's dying, but I don't want to be responsible. And I didn't need to worry because Darren turned to her and said, you can take it away, I don't want it. And I looked at him and looked at her and she looked at me, and then I just take it before he changes his mind, for goodness sake. So she took it and I said, Darren, and he said, don't feel like I need it. And that was it. Never had cyclazine again, never had morphine again, never had a sleeping tablet again after that. I just gave him cannabis. The hospice nurses called it the magic under the bed, because they saw that it had got him away from all of these horrible, nasty drugs, and now he was literally just taking cannabis. And the hospice workers were happy with that. And so for 5 days, I continued to give him this cannabis tinctures 3 times a day, 5 ml under the tongue. And on day 75, one of the bandages came off his fingers. Now, these were necrotic. He'd also had a neurectomy in his hand. So I always get the wrong hand. He'd had a neurectomy in his hand where, because the pain was so horrendous and they couldn't deal with it with medication, they wanted to amputate his hand. And I begged them not to amputate. I said, look, please don't maim him. He's dying. I said, can you just cut the nerve system here so that he just can't feel it? And they said, well, that's awfully permanent. As opposed to full amputation. So I said, look, please, just, let's do this. So they did it, but they said he'll never feel his hands again, he'll never use his hands again, he'll never move, he'll literally be stuck kind of like this. And we said, okay, that doesn't matter. So they put these big Mickey Mouse bandages on, and they said, do not take these bandages off, because underneath there, you need to be in surgery for this. This is, just don't. So day 75, he sat asleep, and he pulled his hand out, and his finger came out, his bandage, and he went, Mum, look at my finger. And I was like, what? What's the matter with your finger? Because I just saw a pink finger. And then I realised that there was only 2 bandages. And oh my God, let me look at your hand. And it looked like my hand, but just with no nails. And the doctors came in and started running around. Well, this is impossible without functioning bone marrow. Yeah, but you told me 5 days, there's nothing in there. Well, there wasn't, and this is impossible. We need to do a blood test. I said, well, what for? You told me there was nothing there. And they said, this isn't right. So they did a blood test, and I still have the piece of paper where they pushed it across the table at me, and I turned it over. Now, I don't know if many people know about neutrophils, but neutrophils are the main part of the white blood cells that fight infection and things like that. It's the neutrophils are the ones that they count. Now, his neutrophil count was 0.0005 when we walked into that hospice, and then subsequently it was 5 days before, and now it was 0.25. It had come from somewhere. And they were now panicking, and they were shredding the do not resuscitate forms, and they were running around like headless chickens. And then they came to Darren and said, well, you're not dying anymore, and so if you get a temperature, what do you want us to do? And he said, you can leave me the fuck alone. And I looked at him, and the doctor said, that's very flippant. And I said, 10 seconds ago he was dying. You can't do this to him. He's planned his funeral. He's been in the room where they're going to lay his body to rest. You can't just expect a bit of flippancy, and so we just continued and continued, and eventually after 8 weeks we were evicted from the hospice. We were told we couldn't live there anymore because he wasn't dying. It was lovely as well. It's such a shame. It was a beautiful place, wasn't it? It was amazing. And so we were put into a hostel because the hospital didn't want us to go back to Norfolk, so they wanted to keep an eye on him. And they would say to him, you don't know, you could drop down dead next week, we don't know what's going to happen. And this for Darren's mental health was just horrendous, absolutely horrendous. And so ensued the next 6 months of the worst 6 months of my life. You laugh. I know. Cancer's one thing, but when you've got your child that's now not died, and you're over the moon that he's not died, you're elated, but he's looking at you like, I hate you for saving my life because I wanted an end to this. And he won't eat. And he's refusing to participate in any form of life. And so for 6 months I had to beg him to eat, and he refused point blank, and he got down to 24 kilos, and at 14 years old I was about 4.5 stone, something like that. It's nothing. I'd never seen anything like it except for on documentaries about Auschwitz. I took pictures to prove to him that one day we'd look back at how bad he was. And this was horrendous because I couldn't get him to eat. I couldn't get him to do anything. And then luckily I met some guys from Bristol Cannabis Club, and one of them said to me, you need to speak to a man called Jeff Ditchfield. And I was like, okay, I haven't heard of it, okay. So I looked him up. And a friend of ours had also said, look, take him on holiday to Spain. I've got a villa over there you can borrow. We haven't been away for years, go away and then have some nice time. Now the hospital was saying, no, we're taking him in, we're going to section him, we're going to sedate him, and we're going to force feed him because there's no other way to deal with this. And I said, you're using a sledgehammer here to crack a walnut. Can you give him maybe some mental health care? He doesn't qualify. Okay? He doesn't qualify. Yeah. If he'd have only been a leukemia patient, he would have qualified. But as soon as you step onto BMT, which obviously is far more, you've gone way down the line. As soon as you're on BMT, you don't qualify for mental health care anymore. So they said, they wanted to section him, and I said, look, please just let me take him to Spain. If he's still the same when you come back, then I will sign him over to you. You don't have a choice anyway, but I managed to buy some time. So they let us go to Spain, and there we met Jeff Ditchfield, and he gave us a syringe of oil, the thick black stuff that I'd heard all about. And he gave us this syringe of oil, and he said, just put a tiny little bit on something, get Darren to put it on his gums, or get him to eat it. And I had no qualms in giving this to him. I had no idea what was in it. I didn't care. Cannabis has already saved his life once. Right, let's try again. And so the following day, I put a tiny bit on a crisp, and he actually ate it. And within half an hour, I was upstairs in the kitchen, and I shouted down to the boys. I have another son, Dylan's Darren's younger brother. They were downstairs by the pool, and I said, I'm making some lunch. Does anybody want any? Thinking I was going to get the usual grunt that I had for the previous 6 months. And Darren shouted up, make me loads, I'm starving. And got me right in the feels. And so I made him lots of food, and he ate it for 12 hours. And the next day he ate for 12 hours. And the next day, and the next day. Pistachio nuts. For 12 hours. Best noise ever. And then after 10 days of that, we went back home and we sat with the lead consultant, and she looked at him and she said, "Oh my God," she said, "his mental health has improved by 300%. I said, "Yeah, I know." And she said, "My God, he doesn't want to die anymore." I said, "Yeah, I know." And she said, "He's put on 4 kilos. I said, "Yeah, I know." And she said, "The holiday did the world of good." I said, "Yes, it was the holiday." Leave it at that. And that's it, I left it there. And every day since then, June 2014, Darren has had 150 milligrams of a 1-to-1 oil every single day, without fail. He went to school, he went and did his last 7 months of high school because he missed everything else. He walked away with 9 GCSEs. Every single day he had oil in his system. I had no idea. And so Darren is now, fast forwards, is the hand that they told me would never work. So 2 weeks after we came back from Spain and Darren's continued to take the oil, he starts telling me his hand's hurting, and I say, "Well, it can't hurt. It's not possible. It's hurt. I'm telling you it's hurting. It's like electric shocks going down my fingers." I subsequently discovered that's called neurogenesis, where actually THC especially can help regrow neural pathways in the brain, so people who have had strokes can see full recovery. And it just, it regenerates nerves. So now Darren has full range of movement in his hand. There's only bits that he can't feel, it's very fingertips. And so it's working. The doctors tell me it's impossible. He also had what's called avascular necrosis in his right femur, where basically the part of the femur is about 1 inch at the bottom of the bone was dead, because over steroid use in a point of his life where he was trying to grow from between 10 to 14. There wasn't enough blood flow to the bone, so it died. And they told me it's irreparable. If he survives, he'll need a knee replacement. Okay, he'll need a knee replacement. So obviously, 5 years later, he goes in for MRI scan, and the doctor sits in front of me and said, "Oh, I believe you were under the impression that Darren had avascular necrosis." No, I wasn't under the impression. I've got the scans. And he said, "Well, because this is impossible." And I said, "Oh, is it gone?" And he said, "Well, yeah, but we don't see that with any of our other patients, And I said, "Well, none of your other patients are on cannabis, or are they?" And he said, "Oh, I knew you'd say that word." And I said, "I'm going to continue to say it until you listen, because it's the only reason why my son's still alive. And I'm not going to stop until everybody has access to this, because if it works for him, it'll work for everybody else." And, so subsequently, I'm going to give you 5 minutes. Anyone who wants to ask him any questions, please ask him some questions, because from my perspective, my perspective is one thing, but his perspective is something completely different. And, I'm very interested to hear his perspective on other people's questions, actually. So I'm going to put you in the spot. That's my son, Darren Blacker.
I will take anything and everything as well. I'm not embarrassed. So, literally any questions at all.
We've got one at the back.
Yeah.
So, in our current system, how do you think we can move forward with education in the medical field? Because obviously, speaking to your oncologists, they probably didn't have a clue.
No, not a clue.
It's a lot of it's through self-research.
Yes.
So, I don't want to see it in the hands of pharmaceutical companies. I don't think people should be persecuted for growing and choosing their own medicine. But surely nurses and GPs, surely they need.
They need education, because it starts at school. I had a science textbook that was telling me that cannabis was addictive. It was a gateway drug. It caused all sorts of problems. Causes cancer, all sorts of things, and that was in my school textbook. So for one, it needs to start changing really early. This was year 6. So end of junior school, you're learning about it, and they're telling you everything that's wrong. So you're gonna have a basis that it's wrong from the beginning. You're not even gonna want to learn anymore because you already believe that it's wrong. So later on in life, it's much harder to learn something that's already embedded into you. It's much harder to change. So it just needs to start at a much earlier level. So anyone that knows about it anyway, if they have kids, don't hide it from them. Explain to them what it is, because you wouldn't hide paracetamol from them, you wouldn't hide a coffee or anything like that. It's exactly the same. So just... It is actually better for you than a cup of coffee. So it's just
Any more questions?
I suppose it's the psychoactive side of it that people say you're out of your head, you know, and parents, the stigma of cannabis, THC, not CBD, but THC in particular, we know it's illegal still here, but how do you get over that with the education? You know, the education schools, I totally agree with you, but it's about educating kids on drugs. You're trying to keep them away from taking ecstasy or all the stuff that's out there. That side of it needs a really concerted effort to say THC can actually help, and you're living proof of that. And I know it helped my older son. He was just too late with a lot of stuff going on. But that is, and I mean, I'm asking you too, THC, people go, psychoactive, he's out of his head, he can't get in the car.
Yeah, it's the lack of education that you understand. You can have high THC, you just got to make sure you have high CBD alongside it to make sure, you know, it's because it's down to the education of people believing. And I say this all the time, you know, it's education. I remember when Durham was in his last year of high school, and he sent me a picture of the cannabis thing and said, "Mum, look at this rubbish." I mean, he sat there with cannabis in his system. But what he did was, I was very proud of him, is what he did, he didn't allow everyone that sat on his table for those 2 hours in that lesson learned the truth.
They did not listen to the textbook after that. I caused quite a...
You did.
Yeah, the teacher didn't really like me.
They're going to know if you keep knowing so much about cannabis, they're going to know what you're doing. Shut up.
Yeah.
And that's the other side of it, isn't it? The THC, oh God, don't mention that.
But if you think about sugar in a kid's brain does exactly the same thing as cocaine. So kids going on sugar rushes are the same as doing a line of coke. Kids are allowed that, so...
And it's just as addictive.
Very articulate point. If we could take one last question. Sorry, we've only got 2 minutes left.
Sorry, it's not a question. It was just to sort of answer the education about in schools. Actually, I certainly know in the area I live in, they have just enrolled into teaching children to research cannabis themselves.
Okay.
So in our secondary school, they did a quite wide study on the benefits and effects of cannabis, and they had to come to a conclusion, which was, should cannabis be legalised for medical uses? And I think that is something they are rolling out nationally. So I do think things are changing. They are changing the education of the young people to you know, that's where it's got to start. So I do think it's changing, and the unanimous in our school was obviously yes. So hopefully people are getting the right research and the children will learn more from that.
That is good. Yeah. Go on, JJ.
How do you feel about recreational use? Because there seems to be an enormous drive from all angles. Everyone interested in cannabis from a business point of view seems to be kind of trying to leave the plant out of it completely. I went to the NEC in Birmingham, I didn't see one cannabis plant. I went to Spanibus, I didn't see one cannabis plant. It seems to be, okay, let's take all the properties from cannabis, turn them into little pills, and we'll just ignore the plant like it never existed. No. But, all of this anecdotal evidence has come about from recreational use. Everyone was smoking cannabis in the 60s and 70s to get high, because it made them feel good, because it, procreated peace and love and all of those things. And none of these old hippies were getting ill. And so, all of a sudden there was this, interest in cannabis, and research discovered all kinds of historical evidence about medicinal use. But recreational use, do you see a line between being well and well-being?
Definitely. I mean, I think recreational use goes hand in hand with medical, because recreational makes you feel good, so is that not medical? Exactly. There's no such thing as a recreational. Yeah, so...
All medicinal. We have an endocannabinoid system, so all use is medicinal use, whether you're using it to prevent it. I say there's two different types of cannabis users.
There's cannabis users that waited until they were sick, until they used it. That's it. Other than that, there was people that was using cannabis that weren't sick, and they weren't sick because they were consuming cannabis. As long as you're not smoking it with tobacco and you use it as the way, as a beneficial way, you don't put other poisons with it, because otherwise you might as well just be pharmaceutical. It's not that. So all use, as far as I'm concerned, is medicinal, because it's a preventative drug and it works for our endocannabinoid system, and we all have one of those. So
everyone should use cannabis.
Everybody.
Everybody must get stoned.
Yeah, we find this, right?
Brilliant.
Kiss us off. Thank you very much for coming and listening to me talk and stuff. Now this has been Darren's first kind of interview.
Thank you,
Yeah,
Darren.
I mean he's been on TV with me and stuff a couple of times, but thank you. Thank you.